My name is Wendy, and I will be presenting the first part of this presentation titled Muscular Dystrophy. In the first part of this presentation, I will discuss the following, which is the definition of muscular dystrophy, the causes of muscular dystrophy, types of muscular dystrophy, symptoms, and tests. Something very interesting that I found is that September 7 marks Muscular Dystrophy Awareness. Something very interesting because since we also have breast cancer awareness, I found this, and it's a green ribbon, lime green ribbon. Muscular dystrophy is a group of genetic diseases that cause progressive weakness and loss of muscle mass. People who suffer from this disease lose their ability to walk and often need to use a wheelchair and need the help of other people. In this picture, you can see that the biceps on the left are a bit thicker, which is normal. Now the biceps on the right have a thin appearance, which represents muscular dystrophy. Muscular dystrophy thins out muscle mass, giving the arm or any part of the body a fragile look. Muscular dystrophy is caused by the absence of dystrophin, a protein involved in maintaining the integrity of the muscle. This diagram shows a muscle cell and its components. And at the bottom, it has the muscle fiber plasma, and within the plasma, the dystrophin protein, which is this yellow squiggly line, and it is attached to the other proteins. Muscular dystrophy is also caused by the inheritance of the X-linked pattern because the gene that can carry a muscular dystrophy mutation is on the X chromosome, which is why boys are most affected. Every boy inherits an X chromosome from his mother and a Y chromosome from the father, which is what makes him a male in the first place, right? Girls get 2 X chromosomes. Sorry about that. Girls get the 2 X chromosomes, one from each parent. So each son born to a woman with a dystrophin mutation on one of the 2 X chromosomes has a 50% chance of inheriting or having muscular dystrophy. These are some types of muscular dystrophy. They are classified based on their age of onset, severity, and rate of progression. The shaded areas on each of these figures demonstrate which parts of the body are affected according to these types. In this slide, we'll go over some of the symptoms of muscular dystrophy, which are frequent falls, difficulty getting up, trouble running and jumping, muscle pain and stiffness, calf enlargement or hypertrophy, trouble breathing, and Gower's sign, which is climbing up their legs. This picture shows Gower's sign. Here the little boy is having difficulty trying to get up, and he's using his hands to push himself on his legs, trying really hard to get up, and finally he stands up. This slide shows one of the most common muscular dystrophies, which is Duchenne, and it usually affects kids from 3 to 5 years old, mostly males. And some of the symptoms here talks about what we talked earlier, which is waddling gait, ambulation frequently impossible by age 12, which will need a wheelchair. Breathing muscles become more affected, which infections arise, and usually leading to death by the age of 15 to 18 years. This slide shows the progression of muscular dystrophy with age. 2 years old are affected. At 8 years old, they're also highly affected, as you can see, lordosis, and by 15, they need a wheelchair. This graph shows the advancement of this disease in terms of age. During the first years of the patient's lives, they will develop walking problems. As they reach 9, they will need to use a wheelchair. By 12 years of age, they will have a very limited use of arms. By 16, breathing problems will arise at night. By 20, breathing problems will be nonstop, leading to an early death at a maximum age of 30. The last topic that we'll talk about are tests and diagnosis. Most common types are enzyme and genetic testing, electromyography, muscle biopsy, heart and lung monitoring tests. This picture shows genetic testing. This concludes the first part of this presentation for muscular dystrophy. Thank you for your attention.